I'm sorry, I got to run in for question period. But I want to start by saying this. This was done with volunteers from right across the province of Ontario. Let's give the volunteers a round of applause, because it shows, when it's shown from community that we want to stand up for a publicly funded, publicly delivered healthcare system. And take a look at these ballots. This is what it represents. You know what Ford thinks it represents? Profits for corporations on the back of 6 people in the province of Ontario. That's wrong, and it should be stopped. Yes, I agree. But I want to say I got a call today, because what's going to happen in our hospital system is very clear. Bill 124 created the crisis. That's how it started. It was orchestrated. And we ended up going through COVID and having our nurses and our doctors get burned out, even though they're given every ounce of energy. Every ounce of energy. They got burned out. And now they're going to go to a private system where they're going to get paid more money, where they're going to have less hours. They're going to work Monday to Friday in clinics. And it's going to suck the nurses and the doctors out of our public system. That is what's going to happen, and then our public system is going to collapse because the dollars are going to go to profit instead of care. Take a look at long-term care. 5,600 people died in long-term care, most of them 78% in private, for-profit long-term care facilities. Nobody in the province of Ontario should die because of that. And I'm going to close by saying, I've been fighting for the hospital system long before I became an MPP. And I've been fighting for the hospital in Fort Erie for 20 years. And we have a couple of people here from Fort Erie. I got a call this morning at 8 a.m. I'm not supposed to announce this till 11 o'clock, so nobody heard this till 11 o'clock. But they're going to announce today that they're cutting the hours in Fort Erie, the urgent care center. They're cutting the hours in the Port Colborne urgent care center. And you know what the reason is? Anybody know? Yell it out. Because of the shortage of nurses and the shortage of doctors, because they're being sucked away into a private system. We need to stand up from every corner of the province of Ontario, stand up for Tommy Douglas, and stand up for publicly funded, publicly delivered health care in the province of Ontario. Thank you very much, and I have to go to question period. Thank you for having me. Thank me to say a few words.